Our focus is on training physicians for rural-based care in northeastern Minnesota. That's in our mission statement, rural and underserved medicine. Obviously, Duluth is an urban environment with an eye to training physicians to work in rural and underserved and undersourced areas. So with every rotation, with every experience, we try to foster a level of independence that one might expect to see in a smaller town where access to specialists is not as readily available. And our physicians and our residents need to learn to be able to think comfortably on their feet and also to have the confidence to project that to patients.
In the last 5 years, we've had a number of people go into hospital-based medicine, so we still have sufficient inpatient experience such that people are being hired and are thriving as hospitalists.
DFMC prepared me for life as a physician in a number of ways. First is the academic or the knowledge side, which will be part of any residency. I was really impressed when I came up as a medical student and interacted with the Duluth residents at just how smart everybody was, at how advanced and how much knowledge everybody in the program seemed to have. And that was something that I wanted for myself when I was looking at residencies. I didn't really realize it at the time, but when I look back, I realized that every day our faculty and our senior residents were demonstrating how to be a physician, and not just how to prescribe medicine or do procedures, but how to treat people and how to interact with staff, and just really set an example that I now realize that I was picking up on every single day. But I realized that I really benefited from the community and the role models that I had here in Duluth.
Our program really prepares you for the practice of your choice, and I like to think of our education program as a very intense but sustainable 36 months that allows you, much like a liberal arts curriculum, to really embrace the full scope of family medicine. We have solid pediatrics, adult medicine, clinic, and we have particular emphasis on obstetrics, especially higher risk obstetrics, the opportunity to do surgical obstetrics and train for cesarean sections.
Well, we work in two different obstetrical systems, meaning Essentia and St. Luke's. Essentia provides, they have a level 2 nursery, so there's arguably more higher risk OB done at that institution, but both systems provide robust and very intense obstetrical experience taught primarily by obstetricians who are totally invested in providing high quality care and high quality training to our residents.
I was very impressed by the OB program here and the inpatient experience. It seems like with having two hospital systems to work with, you kind of get the best of both worlds in a lot of areas, and you get to see really a pretty high acuity for being not in a big city, which was important to me.
You can't go wrong with this program, I feel. No matter what you want to do after you leave, if you want to be a hospitalist, if you just want to do clinic work, if you want to go do ER work, if you want to do everything, you'll get that training here.
Our program recognizes that every resident has something different they want out of training, and within the parameters established by the ACGME, we really try to do our best to meet that. We know everyone's different. It's not a cookie cutter kind of place, and we're really trying to respond to the individual needs of the resident.
I'm hoping to go into full spectrum family medicine, probably somewhere a little more rural. So I really feel like I need to be ready for whatever walks through the door. And I thought this program was really going to offer that.
I think it was the really informal relationship between the residents and the faculty that drew me. I came from a big academic center where I went to med school, so there was a lot of hierarchy and kind of some formality, and it was always intimidating to talk to your attending, and I could just tell when I came here that they very much have a literal and figurative open door policy, and they're always willing to help even if it's not related to something that they're involved in.
And in a beautiful location. It's tough to beat Duluth in terms of outdoor activities and just having a beautiful city to live in.
One of the unique things that we offer at this residency is that even though we have a rural focus in terms of preparing people to practice in rural settings, our clinic is actually located in the center of Duluth, and so we have very much an urban underserved feel to our patient population. So for prospective residents who have a strong interest in kind of urban underserved or are feeling a little bit like they're not quite sure where they want to go when they're done with residency, we kind of have this ability to offer a wide experience.
You will be doing intubations, central lines, arterial lines, and gaining a lot of management pearls as far as ventilators, sepsis, antibiotic choices. And I think this is a unique foundational experience. Even if you never do ICU again in your career, you have it, and you have that procedural experience. So if you're in a rural ED and need to stabilize a patient, intubate them, get a central line, get an arterial line, you have been down that road. Additionally, I think our outpatient psychiatry experience, we regularly manage a lot of patients with persistent, pervasive behavioral health concerns, and being comfortable with antipsychotics, mood stabilizers, and monitoring and side effects is a nice option because in most parts of the country there's a definite shortage of behavioral health providers, and being able to meet patients where they are and meet that need for behavioral health medication management is feels like we're making a difference.
In the last, I'd say 5 years or so, we've really become more involved with the community, and that's been through efforts of our residents. Through our program, we do have community outreach opportunities that residents can participate in at any stage of your training. One would be the Health and Homelessness Committee. A second one is our Respite House, which right now we usually have a resident lead that takes that responsibility as well as any other residents who are interested. It's very rewarding work. I see residents realizing what a great reward this is. The other thing is, if you can take care of people that have had this kind of trauma in their life, you can take care of anybody.
Our residents get exposed to Suboxone right from the very beginning. You're not able to get a waiver till your second year, so you're not seeing patients independently until that point, but you are exposed to Suboxone because we recognize this is a real healthcare crisis, and our residency has responded to that in our community. One of our residents went to Woodbury. She'll be practicing full spectrum OB, full spectrum family medicine with OB. 3 of our residents went to northwestern Wisconsin and are going to be doing full spectrum family medicine with OB. One's may do some moonlighting in the ER. Another joined a practice in Alexandria, full spectrum OB with ER, inpatient peds, and non-operative obstetrics. Another resident is doing some locums work in Hawaii, I believe. Another resident is going to be doing full spectrum work or ER work out of Grand Rapids, Minnesota. We're starting in October. Another resident is working as a hospitalist here at Essentia. Another resident is working in Warwood, Minnesota, providing obstetrical care up in that northern community. So it kind of runs the gamut, but you can see that several of our residents are doing OB, and one of them is doing C-sections, one's doing full-time OB, one full-time ER. So primarily a niche in rural areas. I know you're all viewing this because you're getting ready for a pivotal decision in your life to decide where you want to go to residency, and that is going to set you up for where you may practice for the rest of your career, a large portion of career, perhaps for those of you who haven't met a special someone in your life, where that significant other will be, and eventually where you may end up raising a family. So these are big decisions. And I recognize that the virtual platform is not the easiest way to do that, and I totally get it. I can understand that perhaps it's frustrating, you're not going to get a sense of who I am, what our program's like, but I honestly really want you to consider our program for several reasons. One, I think our culture is a kind of a honest place where you're free to be who you are, express your opinions, and we have a can-do, kind of a team-spirited oriented. We like to work hard, but we also like to play hard. There's a multitude of outdoor activities just outside our doorstep. Last year, one of our residents skied to work. We had a 22-inch snowstorm in early December. He skied to work. I've skied to work several times, ride my bike to work every day. The largest lake in the world, or third largest lake by surface area, my apologies, it's just a half a mile from our clinic. You can run down there and take a swim after work. A lot of great restaurants in town, a real fun atmosphere, hiking, biking just right outside your doorstep. Plus the cost of living is pretty reasonable and the commutes are really simple. You got our hospital situated equidistant from our clinic, so you can walk everywhere during the course of your day.
I have nothing but great things to say about Duluth Family Medicine program. It prepared me academically and socially in ways that I never knew I needed when I started residency. But here in Duluth, the entire team, whether it's the faculty or the staff or community physicians, are just so dedicated to your learning and development as a physician and as a person. And I didn't really understand what I was getting myself into when I started here, but I'm so glad it worked out the way it did.